My name is Laura Stachel. I'm the Executive Director and co-founder of We Care Solar. I'm an obstetrician gynecologist doing public health care, and I went to Nigeria in 2008 to try and understand why so many women were dying in childbirth. One of the things I saw in the hospital was that there was a significant lack of infrastructure. Doctors couldn't do the procedures they were trained to do because they didn't have lighting, they didn't have reliable electricity. I saw a C-section that was started, lights went out in the middle of the procedure, and the only light they had to finish was my own flashlight. It was something that was inconceivable to me that a hospital serving a city of 1.5 million people didn't have a reliable electricity structure. Being a solar innovator, my husband said, when you come back, maybe we can work together and come up with a solution for this one hospital. What we were thinking of was using solar electricity and very high efficiency appliances. I wanted to go back and show that to them before we did a larger installation in the hospital. I said to my husband, can you create a system small enough to fit into my suitcase so I can get through customs very quietly? And that was actually the genesis of the solar suitcase. People there were ecstatic. They're like, can you leave this here? And I said, actually, this is just our demonstration kit. We're going to bring in a much bigger system. The clinic started saying, we don't have light either. Can you help us? Why are you only helping the big hospital? We thought, well, maybe we could use this suitcase-sized system as a way to have a scalable source of solar electricity to bring to clinics. People started writing to us saying, can you also help our clinic? And we started realizing that the problem we saw in Nigeria was actually a fundamental problem worldwide. One of the midwives in the very first clinic that had the solar suitcase told us that up until then they were trying to do surgical repairs, suturing up women with lacerations by candlelight, and they couldn't really examine babies at night because it was so dark. And she said, this is really saving lives. And I just walked out of the clinic and started crying. It takes a huge amount of work to do a project like this. Just knowing that it's truly saving lives and making a difference is huge.